Hey guys, welcome back to my channel. Myself Arpita. Today I will tell you something about the coronavirus. If you like my video, subscribe to my channel and press the bell icon. So friends, let's start the video. Prevent COVID-19. How to protect yourself from the coronavirus. Follow this simple precaution to reduce your chances of connecting COVID-19. The COVID-19 pandemic has been a part of our daily life since March 2020, but with about 115,000 new cases a day in the United States and the USA death toll at more than 464,000, it remains as important as ever to stay vigilant to and know how to protect yourself from coronavirus. According to the Center of Disease Control and Prevention (CDC), the best way to prevent illness is to avoid being exposed to this virus. As the vaccine continue their rollout, here are the simple steps you can take to help prevent the spread of COVID-19 and protect yourself and others. Know how it spreads. Scientists are still learning about COVID-19, the disease caused by the coronavirus. But according to the CDC, this highly contagious virus appears to be most commonly spread during close with 6 feet person to person contact through respiratory droplets. The means of transmission can be through respiratory droplets produced when a person coughs or sneezes, or by direct physical contact with an infected person, such as shrinking hand, says Dr. David Goldberg, an internist and infection disease specialist at New York Presbyterian Medical Group, Westchester, and assistant professor of medicine at Columbia University Vigilance College of Physicians and Surgeons. The CDC also noted that COVID-19 can spread by airborne transmission, although this is less common than close contact with a person. Some infection can be spread by exposure to virus in small droplets and practice that can linger in the air of minutes to hours. The CDC states this virus may be able to infect people who are farther than 6 feet away from the person who is infected or after that person has left the space. This transmission occurred within an enclosed space that had inadequate ventilation. Finally, it's possible for coronavirus to spread through contamination surfaces, but this is also less likely. According to the CDC, based on data from lab studies on COVID-19 and what we know about similar respiratory disease, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. Practice social distancing. Since close person to person contact appears to be the main source of transmission, social distance remains a key way to mitigate spread. The CDC recommends maintaining a distance of approximately 6 feet from others in public places. This distance will help you avoid direct contact with respiratory droplets produced by cough or sneezing. In addition, studies have found that outdoor sitting with enough space to distance and good ventilation will reduce risks of exposure. There is up to 80% less transmission of the virus happening outdoor versus indoor, says Dr. Ashwin Bhashan, an assistant attending physician in the Department of Medicine at New York Presbyterian Columbia University, Larving Medical Center, and an assistant professor at the Mailman School of Public Health and Columbia University Vigilance College of Physician and Surgeon. One study found that of 318 outbreaks that accounted for 1,245 confirmed cases in China, only one outbreak occurred outdoors. That's significant. I recommended spending time with others outside. We are not talking about going to a sporting event or a concert. We are talking about going for a walk or going to the park or even having a conversation at a safe distance with someone outside. Wash your hand. Practicing good hygiene is an important habit that helps prevent the spread of COVID-19. Make the CDC recommendation part of your routine. Wash your hand often with soap and water for the last 20 seconds, especially after you have been in a public place, after blowing your nose, coughing or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing or sneezing, after handling your mask, after changing a diaper, after caring for someone who's sick, after touching animal or pets. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands with the sanitizer and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Visit the CDC website for guidelines on how to properly wash your hands and use hand sanitizer. Soap kills the coronavirus. This plenty of science behind the basic habit. Soap molecules droplets the fatty or coat surrounding the virus, says Dr. Goldberg. When the viral coat is broken down, the virus is no longer able to function. In addition to hand washing, different frequently touching surfaces daily. This includes table, doorknobs, light switches, handles, desks, phones, keyboards, toilet, and skin. Wear a mask. Face masks have become essential accessories in preparing yourself and others from connecting COVID-19. The CDC recommends that people wear face masks covering in public settings, especially since studies have shown that individuals with the novel coronavirus could be asymptomatic or pre-symptomatic. Face masks, however, do not replace social distancing recommendation. Face masks are designed to provide a barrier between your airway and the outside world, says Dr. Olive Hermia, medical director of Weill Cornell ID Associates and Travel Medicine in the Division of Infection Disease at New York Presbyterian Weill Cornell Medical Center and Weill Cornell Medical. By wearing a mask that covers your mouth and nose, you will reduce the risk of serving as the source of disease spread by trapping your own droplets in the mask, and also reduce the risk of getting sick via droplets that contain the coronavirus by blocking access to your own airways. Restrict your travel. Traveling can include the spread of COVID-19 and put you at risk for contracting the disease. The CDC recommends avoiding non-essential travel to many international destinations during the pandemic. It also advises people to weigh the risks when it comes on domestic travel. Travel increase your chance of getting and spreading COVID-19. States the CDC, staying home is the best way to protect yourself and others from COVID-19. For people at risk for the complications of COVID-19, such as those with underlying medical condition or those who are older, it's prudent to avoid travel, says Dr. Goldberg. If you must travel, take safety measures, consider your mode of transportation, and stay up to date on the restrictions that are in place at your destination. Adhering to your state quarantine rules after traveling will help prevent the spread of COVID-19. Watch the symptoms. The symptoms of infection for the coronavirus are often similar to those of other respiratory virus infections such as influenza. Symptoms can include fever of chills, cough, shortness of breath, of difficulty breathing, fatigue, muscle or body ache, headache, new loss of taste or smell, sore throat, contagion or runny nose, nausea or vomiting, diarrhea. Okay guys, I hope the video will be helpful to you. Thanks for watching this video. Stay home, stay safe, take care, bye bye.